Good evening, everyone. Today is May 26, 2022. We actually do not have a quorum as of yet. So what I'd like to do with everyone's, with no objection from anyone, just to be able to start the meeting, to go ahead and have some presentations heard this evening.
Is there any objection?
Is there any objection?
No.
Okay, well, with that, then we will go ahead and get started with our presentations. And I think the first item we have is, it would be under old business, item 3, and this is the non-business of the evening, but presentations, continuing behavioral health initiative update. And this is the school-based health center, and we'll have Charlie Verplo requested that this item be placed on the agenda this evening, and the following individuals will be discussing this matter. Again, Ms. Verplo, Dr. Christine Muir, and Vicki Price. Welcome.
Thank you. We're going to let Dr. Muir begin the presentation, and then I'll be next.
Thank you all. Madam Chair and members of the committee, we're very pleased to come in front of you to give you an update on the mobile school-based health center initiative that is funded through the county and collaborating with Albuquerque Public Schools. So I'm Chris Muir. I'm the Executive Director for the Student Family Community Supports Division for Albuquerque Public Schools. And with me is Vicki Price, who is the Senior Director for Counseling. And with Charlie, we will be tag teaming a presentation for you and then give you time to ask us questions or comments. So I wanted to start with just providing you with a brief background on school-based health centers so that we can put this initiative sort of into perspective. So school-based health centers have been around for a very long time. And the purpose of school-based health centers is to provide quality, integrated, youth-friendly, and culturally responsive health services to keep children and adolescents healthy, and primarily so that they can stay in school and are ready to learn. The purpose of school-based health centers on site is primarily so that students don't have to leave campus to get health care, both primary health care and behavioral health care. So it's preventative in nature, and that keeps kids in school longer. So typically during the day, you'd have to take your kid out of school. It could be minimally a half a day or a full day just to go for a doctor's appointment and get those services. So school-based health centers have been providing these types of services for school-age children and adolescents since 1960. So when I said they've been around for a long time, they have been around for a long time. And so the first school-based health center in Albuquerque was actually in 1978, and that was at Rio Grande High School. And it was one of the first school-based health centers in the state. So across the nation, there are now approximately 2,000 school-based health centers. New Mexico has 80 school-based health centers throughout the state, 12 of which are in Albuquerque Public Schools. So we currently have school-based health centers at 6 of our high schools, 4 of our middle schools, and 2 of our elementary schools. So the APS school-based health center services are delivered right now by 4 different providers. And so UNM Medical Group, UNM Hospital, First Nations, and First Choice are the providers. APS does not choose the providers. We don't contract with the providers. They provide the services. As a clinician, we provide the space. And we actually have lease agreements with all of those providers and some service agreements on the services that they have chosen that they will provide. Our Board of Education authorizes and supports the operation of their school-based health centers, and both school-linked and all health services in our schools. But they don't choose the clinicians are actually a separate clinic on our campuses and run that way. So the primary source of funding right now for school-based health centers is the state of New Mexico, the Department of Health. And number 2, health insurance. And that primarily is Medicaid or other third-party billers. Not all of our school-based health centers are FQHCs, so they cannot take other third-party billing, but they can bill Medicaid. Now, through this collaborative with Bernalillo County and the Behavioral Health Initiative, we're excited about having mobile school-based health centers so that we can provide services to more schools on our campuses. We spent a lot of time together, probably 2 years in the making, and working out a lot of the kinks. And we want to tell you where we're at right now with it. So I'm going to turn it over to Charlie, and she will tell you where we are in terms of getting those mobile vans onto our campuses.
Thank you so much, Dr. Amir. So my name is Charlie Gerplu, and I oversee the Behavioral Health Initiative for Bernalillo County. I want to say hello to the chair and members of the commission. Really glad to be here tonight and be talking to you guys about this project. The Behavioral Health Initiative approved $800,000 for school-based health services and $800,000 for capital to buy 2 mobile units in order to provide those services. The funding was approved through the Behavioral Health Initiative and went through our Behavioral Health Initiative Steering Committee and the Behavioral Health Commission on February 27th, 2020. This is, again, a collaboration between our department, Behavioral Health Initiative, and APS, and it's created to build and operate 2 mobile school-based health centers. The units will be slated to operate and rotate on a schedule throughout a variety of schools. So they'll go through middle schools, elementary schools, APS schools, and charter schools in order to provide those medical and behavioral health services. The parts of this project are multiple. So the first step was to procure the units. We've done that. We've ordered both 2 of the units and spent that $800,000 on capital. We need to identify a service provider. We're in the process of contract negotiations with a service provider. And then we need to select the school sites. So in terms of the first steps with the mobile units, we worked with our fleet department to find a vendor to procure those 2 units. And again, they'll be slated to arrive in early spring 2023. And then we're working with a community provider in order to develop a contract where they can provide both those medical and behavioral health services on those units to a variety of schools. And the next step is to identify schools and do a site selection. And so I'm going to turn it back over to APS to talk about that process.
Okay, I guess it's my turn. Thank you, Madam Chair and members of the commission. I'm happy to be here. My name is Vicki Price. I'm Senior Director of Counseling Services. So in this partnership, as Charlie was explaining, we started looking at all the schools in APS. So the first thing we did was look at every single campus that we have. And then we had to work with our physical department. So what they did was they looked at what schools had areas on their campus that could house a school-based health center van. So there were schools that we had to eliminate because they just couldn't house a van, didn't have a space in their parking lot to accommodate a van. So that narrowed the list down to 48 schools. So we had 48 schools that had the space in their parking lot, they could accommodate the van. From there, what we did was we started looking at all the mental health data that those schools have. We have a lot of data. We use our health and wellness team data. We also look at how many suicide referrals we've had, how many times the crisis team has gone out, nurse office visits, and we also looked at visits to the nurse's office that had a psychiatric component to it. And of course, we looked at enrollment too, because we want to make sure it's a big enough school that would keep the van busy and would provide services for a number of students. So once we started looking at that, we narrowed down our list. The other thing we wanted to do is we wanted to make sure that every section of Albuquerque had a van. So our school district, we divide them up into 4 zones. So our intent was to at least have 1 school in each zone that could accommodate a van. So again, we narrowed down our list. We came up with 3 schools in each zone, and it coincidentally, we had our data and Bernalillo County weighted theirs, took our data and weighted it a little bit differently, but we came up with 3 schools that we all agreed on to each school. Really, when it comes down to it, there was a number of schools we could have selected. We just tried to pick the ones we thought had the most need and where the vans would be the most successful. So from there, of course, I went to APS leadership. They looked it over, they prioritized what they were thinking, and then we came up with 1 school in each district. And of course, then we have we had school 2 and school 3 in each zone. So we still have that. But we did select Manzano Mesa, which is in zone 1, and zone 2 is Jimmy Carter Middle School. Tony Hillerman Middle School is in zone 3, and Cleveland Middle School is in zone 4. I think these schools are great picks, and I do think they'll be highly successful at this school. But the one thing to consider, and Charlie and Chris and I have talked about it a great deal, is they are mobile vans. So, if it turns out that it's not working well somewhere, we can always look at shifting it around a little bit. So, once the vans are in place, we'll be able to start the service. We're also looking at each of these schools in the fall, doing at least some partial services because the vans aren't quite ready. So we would be doing some partial mental health services at these schools while we're waiting for the vans. The advantage to that is it gets the schools used to utilizing some of the services, so that the change to have kids walk out to the van outside won't be as great because they'll already be used to seeing some of these people. I think that's all I had. Chris and Charlie might have additional things to add, but we are super excited about this project. It has been a great partnership with the county. So, I think it's innovative and new and something that we really needed to try.
And I just wanted to emphasize that because the van, and no fault of anybody's, are not ready yet. Part of that is just like everything else, trying to get anything and order things. There's a delay. We came back together, and we're going to start with some behavioral mental health services at those school sites, hopefully as early in the fall as we can. Once the provider is on board, we'll be able to start those services, and kids can begin to understand who those people are. Once the van's there, we'll integrate the primary care services with those also. So again, we're very excited about this project. It's been a great partnership with the county, and we will stand for any questions that you have.
Thank you. What a great presentation. Does anyone have any questions? Commissioner Barboa.
I don't have any question. I just want to say thank you for the work, to everybody doing it. I know I was really excited when I first started to hear that this was one of Commissioner Quesada's babies, and that so good to see that it's coming. And I know I, as a young person, benefited out of a school-based health center being at Albuquerque High. And I think the idea of mobile units is even better and greater for families and families of the students to be able to access. So just want to give props and appreciation for your work.
Thank you. Thank you for the presentation. And maybe next time when we actually have a quorum and are able to, maybe we can put these items back on there just as a brief rebriefing, and there can be some additional questions, and there can be some formalities so that we get all this on record. So with that, we'll move on to item B, which is opportunities for subcommittees to address the commission. I don't know if there's anyone from the subcommittees here this evening. If you are, can you please say your name? No.
And I might as well start. I'm Michael Barndollar, and I'm the chair of the Supportive Housing Subcommittee for the Behavioral Health Initiative. And Madam Chair, members of the Commission, very briefly about 3 items that I want to mention. One is, at our last meeting, we had a report on the status of evictions in the county, given the moratorium, state of New Mexico moratorium on evictions has ended. And we're really going to follow the issue. We seem to be not experiencing the spike that other places in the country are experiencing post-moratorium, but it's a concern to us because there's a clear potential that a lot of these folks are going to wind up needing shelter on the street in some way or manner and needing housing. So we want to follow that. The second thing that came up that we're following, which is kind of interesting, is a universal right to housing. The United Nations has such a right in their human rights documents. The National Homelessness Law Center is developing, they did in 2021, developing a policy around that. So we'd like to follow that and perhaps bring it back through our steering committee and to the ABCGC plus APS at some point, see where that goes. The last thing that I want to mention is that we're slowly but surely working with the Department of Health on looking at how we can license boarding homes throughout the county. Right now, there are a lot, they're not licensed, and they become dumping grounds for people with behavioral health issues, and they're a disaster. And people are not getting treatment. They're living in very, very substandard conditions. And so hopefully through a pilot project, we can bring some of those boarding homes up to standard, make sure that, in fact, they meet at least building code, and perhaps get some services going as well. So we're going to bring that back to you again at some point. So that's all I have, and I stand for any questions on any of those three issues.
Thank you. Are there any questions? I see Commissioner Barboa with her hand raised.
Hi, Mr. Barndaller, good to see you. Can you please, I don't know what you're talking about when you talk about boarding houses. Can you please? inform me?
They're just individuals who buy homes with multiple bedrooms, and some charge rent, most charge rent to just house people in them. And the stories that we hear are horrific. I mean, in Las Vegas, New Mexico, that's become the standard for people leaving the state institution for behavioral health. They just get dumped in these homes. But it also, there are quite a few here in Bernalillo County that we have to look at. One report we heard from the Department of Health, or actually one of the members of our committee, is that one of these homes, because of a lack of heat, was actually giving the people who are living in these rooms heating pads that they were actually, and other kinds of heating devices that they were actually keeping in their bed under the blanket. Refrigerators out in the yard, no electricity at times. So they're, pardon my expression, but they tend to be hellholes. And we'd like to do something about it because it's just not appropriate care.
Thank you. Charlie.
Thank you, Chair. Thank you so much, Michael. I really appreciate that summary. And I also wanted to add in that we had a conversation with DHI, which is an office underneath the Department of Health. And they mentioned that they're going to do a survey and should be finished in June across the dozen or so group homes that exist here in Albuquerque that are housing individuals with severe mental illness. And they're going to be talking to them about what they would need to come up to code in order to meet the state regulations for the DHI department. So we'll be talking with them in more detail once that survey is complete, and then they'll be able to tell us what's needed in terms of funding to be able to help those facilities get up to speed. So we'll give you guys an update as we move forward with this, and any other questions, happy to answer them.
Thank you, Ms. Verplo. And Mr. Barndaller, again, I'm just going to repeat it probably 100 times this evening, is just to say that if you want this a matter of record, make sure to bring these points up at next meeting when it'll be officially documented. So with that, I will, are there any other questions from members? I see Ms. Vihil's hand up, but we're going to wait, Ms. Vihil, because this is for the commissioners and the members of the board. Anyone else from the committees? Commissioner Barboa.
Thank you, Chair. I just so Charlie, you had mentioned group homes. I know that there are, I guess I just want to make sure clarity. What Mr. Barndaller explained sounds like Adrienne can get a house and just sort of rent, but I know there are also group homes where they're like people actually getting people's disability income to and get some significant funding, right, to support folks with disabilities. And I've heard about those being somewhat not up to par for the kind of care. And I guess I'm just wanting to make sure that I'm clear. Are those two different ways where that things that are we agree are happening, or yeah, are these like state sanctioned homes that we're saying? No, these are just like
that's
people.
The issue is that they If they close them, then there aren't spaces for these individuals to go, but they haven't been able to meet the requirements to meet the state regulations to become licensed. So they're unlicensed boarding homes technically, but they do house individuals who have serious mental health or behavioral health needs. I don't believe that they would be taking disability support from the state in this case, but we do believe that if we could get them up to standards, then they would be able to be licensed by the state, regulated by the state, and then the state could provide individuals from, say, a group like APS, from Aging and Long-Term Services, to those facilities. And so they said they had 3 homes that they were going to be able to get up to standard when we met with them in March. And so they told us to meet back with them in June and find out an update on the survey. So we can bring back the survey here, Chair Pena, and give you guys an update on how we're doing in the next couple of months.
Thank you. So I don't see any other hands raised, so I think we'll move on to public comment. So do we have anyone signed up for public comment?
Madam Chair, yes, we have May Sagbacken.
Okay,
May, you can feel free to turn your video on, unmute yourself, and you'll have 2 minutes.
Did you say I could speak now?
yes.
Yes, ma'am, please
All right,
proceed.
good evening, everyone, and thank you for having me, Madam Chair and the members of the committee. I'm actually joining today because I saw that school violence was on the agenda, and that's, I think, is later on the agenda. And as you know, we've had a national tragedy again. And my questions to all of you, and I know APS members are in this meeting today, and also the county, is the ongoing collaboration between APS Police, APD, and BCSO, and how that's going. Because 10 years ago, when I was in APS, that partnership was not very functional and can really cause some delay in a response when there's a crisis in a school. So as a public member, I would like to get an update from APS as to how that partnership is going and how communication will happen if we have a school shooting in an Albuquerque school. And I'm also wondering in terms of school shootings that has been prevented, because I know that there are a lot of incidents in our schools where police does a great job and they actually prevent school shootings. And there's been a tendency not to share that data. And if we don't know how many school shootings have been prevented, we're losing 2 things. We're losing an overview of what's actually happening, and we're also losing some best practices, what actually has been working. And right now, I think it's really important to understand what the police have done well, or counselors or social workers. There's usually a team in each school. And I would encourage APS and charter schools to share what has been prevented, so we understand the scenario in Albuquerque and can learn from lessons learned. And I personally was in Norway when they had a big massacre with Breivik, who has been a role model, unfortunately, for a lot of the incidents in the US. And the police was delayed an hour, 45 minutes to an hour. So many kids were shot. And we see the same thing in Texas. So I think the whole idea of collaboration and communication is essential when you get federal, state, and local police and school police arriving at the scene.
Thank you, May. Your time is up.
Yeah, help us understand what the status is. Thank you so much.
Thank you. We appreciate your comments. Does that conclude public comment?
Madam Chair, yes, it does.
Thank you. So with that, we will move on to new business. And this is item A, statewide behavioral health comprehensive plan presentation. Council Bassan approved this matter be placed on the agenda. The following individuals will be discussing this matter. This is Ms. Connie Vigil and Mr. Ron Bernstein. And we will 5 minutes for this presentation. Thank you.
Thank you, Madam Chair and members of the committee. My name is Ron Burstein, and Connie and I are here to discuss the statewide behavioral health master plan. Again, my name is Ron Burstein. I'm president of the studio Southwest Architects in Albuquerque. And over the last several years, we've completed several behavioral health projects for Bernalillo County, including the Care Campus and the Reentry Resource Center, in addition to other projects around the state. Some of our projects have included behavioral health additions to detention centers, because in many places around the state, detention centers have turned into behavioral health treatment centers of last resort. I came up with the idea of a statewide behavioral health master plan during an interview with Gene Grant that Connie and I did a few years ago. And that was after we in the office were trying to create a behavioral health flow chart showing the work that we had done for Bernalillo County for a proposal. And as we were doing that, it just became clear that there were holes in the system and missing components. So the master plan, in the big picture, the master plan will look at best practices, examples of solutions in other states, existing facilities, existing programs, and make recommendations for the improvements in the overall system. One thing is clear, that the master plan must not only include programs and facilities, but also funding and ways of staffing any new programs or facilities that are constructed. From the master plan, $100,000 was funded by the 2022 legislature. It's in SB 001, and the funding is going to be administered by the Behavioral Health Collaborative under Bryce Pittenger as part of the Human Services Department. So I'm going to pass this to Connie to provide some more details. Connie, you're muted.
Ms. Vigil, you are muted.
Okay, can you hear me now? Hello?
We can hear you, Connie.
Yes, thank you.
You're muted again.
Can you hear me now?
Yes.
Okay, great. I wanted to draw attention, thank you, Ron, and members of the committee. First of all, I'd like to acknowledge City Council members who have been routinely attending these meetings. Brooke Bassan, who's not there, Tammy Feeblecorn, and Louis Sanchez has attended practically all our meetings. We have actually been wanting to have the county also attend, but we haven't had any county commissioners attend, so we'd like to encourage them to start attending. I'm going to draw your attention to some documents that I provided to your secretary, and that was the gap analysis done in June 2021 by the city and the county. A part of what we've decided to do as a strategic plan is actually listed in that gap analysis. And if you have it in front of you, in case you don't, I'll just point out, it's the 2021 study that was done by Via Positiva, paid for by Bernalillo County and Albuquerque at about $80,000. On page 44, it says, create a structured intergovernmental collaborative body operating from one comprehensive, unified, detailed strategic plan. Well, as you know, we created Gabriel's Village, which was a transitional housing model. We did present it to county and city several years ago, but we didn't get much traction. So I decided to go on the state level, and Linda Lopez sponsored my bill, Senate Bill 191. As Ron said, it was funded last year. Jerry Ortiz de Pino, several senators and House reps from across the state have been supporting it. And I want to say that we are well on our way towards the goal of including all counties and cities in a statewide strategic plan. I also like to point out other pages in your report, which point to the fact that really we don't have collaborative work between the counties and the cities, and especially with our legislators. So I'd like to say that Jerry Ortiz Pino has been very instrumental in bringing the funding back. And we really hope to bring some programs that have been brought to our attention through other resources. I also brought the video definition of insanity to your attention. This is a program out of Dade County, Miami, that we are actually looking at as a legislative body and the justices here in the state. Jerry Ortiz has asked me to invite the judge in the video, so please watch it, Definition of Insanity, YouTube. That is a program that we will be bringing into all the cities and counties as the legislators themselves bring that to fruition. The goal is actually to help all cities and all counties to have a strategic plan, and we know that we'll have federal funding, and we need to have grant writers. There's all kinds of parts of this puzzle, including drug prevention in the schools and transitional housing. But I just wanted to let you know that we're well on our way, and We've had county commissioners from Sandoval County, Taos, Roswell, Doñana, and we're hoping that the county will come on board as well. I stand for any questions that you might have.
Are there any questions? I don't see any questions. So thank you for the presentation. I appreciate it. I think
Thank you for your time.
with that, we'll move on. I'm of the understanding that there was a couple of more subcommittee members who wanted to address the committee, if you will. Is that correct?
Yeah, and if you don't mind, Chair Pena, I think maybe I could start with a quick BHI update just to let you guys know about some of the things we're working on. And then I'll turn it over to Kate Reeves, who is our steering chair, and also Cynthia Sontag, who's our chair of our steering committee, in case they have anything they'd like to share. So if that's okay, I'll go forward with the BHI update.
Sure.
Okay, I'll try to be quick. We work on a lot of things, so I always want to make sure that this committee is aware of all the things that the BHI is working on. One is that we work with a provider named Recovery Services of New Mexico, and they provide medication-assisted treatment at MDC. And we are glad to be able to announce that they're moving forward with doing induction services for Suboxone at MDC. They've always been doing maintenance and also methadone services, but now they're doing induction of Suboxone. So we're really glad to have that, and that'll be for individuals identified with an opiate use disorder, but are not necessarily coming into MDC using Suboxone. So they just have an opiate use disorder and are interested in using MAT Suboxone in order to address that opiate use disorder. The other couple of items I wanted to mention is that we're doing a living room model. It's going to be called the Imagine Wellness Center, and it's going to be in Tijeras. We entered into an agreement with a provider called Albuquerque Center for Hope and Recovery, and they're going to be providing peer services in the village of Tijeras at the Imagine Wellness Center. We're currently waiting for our certificate of occupancy of that space, and as soon as that moves forward, then we anticipate for services to begin about mid-July or so. Our school-based health centers are really exciting, and our mobile units will be arriving 2023, and you guys already received an update on that today. Our tiny home village is moving forward, and we just executed an agreement with the Office of Community Health. They're with the University of New Mexico. They're going to be providing behavioral health services there at the tiny home village. We've also worked to get an agreement together with a medical provider. It's the UNM Southeast Heights Clinic, and they're basically just across the street from the tiny home village. So they'll be doing screening and primary care for the individuals at the tiny home village. And the last thing I wanted to mention is that we're doing our second single site. We have our first single site up and going. It's called Hope Village, and it's being operated by HopeWorks. This is our second one, so we're really excited about that. It's basically a larger apartment complex that's for higher acuity behavioral health clients that don't do as well on their own in an apartment, just being working with a provider once a month or so. They really need to have those wraparound services on site. So the county will be currently contracting with a new architect to be doing the design and build of that building, and the BHI is working on negotiating a contract with the behavioral health provider. So we'll give you more updates as we move forward with that. And I'd like to be able to turn it over to Kate Reeves. She's our chair for our steering committee, as I think she had a few updates she wanted to share with you guys.
Thank you so much, Carly, and thank you, committee, for having us here to share our updates. I will be brief. My name is Kate Reeves. I am the chair of the steering committee as well as the subcommittee Intervention, Prevention, and Harm Reduction. I'd like to update on the subcommittee. We've spent some time over the past couple of meetings really focused on prioritizing for the upcoming year. We determined 3 priorities of focus. Those include familiarizing the subcommittee members with the BHI programs associated with intervention, prevention, and harm reduction, supporting BHI with feedback on their marketing plan and outreach efforts. As well, the Prevention, Intervention, and Harm Reduction Subcommittee will work with the BHI to identify areas of improvement specific to usability for the current BHI website. And lastly, members of the subcommittee really felt it was important to engage in an evaluation of our current family support services offered throughout the county. to determine if there is a need to expand any of those programs, again, specific to family supports. And that is my update. I think Cynthia is on from our crisis subcommittee, so I will hand it over to her.
Thank you, Kate. I'm Cynthia Sontag. Thank you for giving us this opportunity to share with the committee. I'm with the crisis subcommittee and I chair that. And right now we've identified two things we do really want to be updated on and continue to work towards. The first is the Crisis Triage Center. It's the only program that's not up and running because it's been under development for a really long time to do it right. And we're going to get our latest update at our next meeting. We are now meeting monthly so that we can stay on top of things and really know what's going on. And the second thing is that we really want to support all the programs that are already in place. By getting updates in person, we want to go and support the programs by letting them know, the managers, that we are directly involved in helping support them with anything they need in gaps in services, what their progress is, give them a real chance to get a good pat on the back and keep going and be motivated because we're there for them as well. And what we're going to be doing is looking at the progress, view data on the program's usage, and looking for gaps in services to enhance their programs with what we already maybe have as opportunity. And that's my report.
Thank you so much, Chair Sontag. And then we also have Chair Crispin on. He's with our Community Supports Committee. And if it's okay, I'd like for him to just say a few words as well.
Absolutely.
Thank you so much, everyone, for being on this call. Thank you, counselors. Thank you, commissioners. Thank you, Charlie. And thank you to my colleagues. I just wanted to say that we had a really good meeting this past month. We're going to be continuing to have invitations of speakers for upcoming meetings from people that are from different communities. This past month, we're planning someone from the community service agencies. And next month, we're planning somebody from the Black Mental Health Coalition or the Trauma Recovery Center, which that will be very helpful for our communities, for our committee. If other presenters that we have in mind is Mark Clark with DVHS to return to provide COVID-19 updates. He's been really helpful in our committee and helping us to get out information and awareness about COVID-19. Also, we'll be having, we discussed priorities of our old business agendas, which discuss priorities for the year upcoming. And we had a couple of members from the subcommittee suggest making the process more equitable for community-based organizations and funding, and just further explaining the different services that are available. But everything's been going on well, and we had Mental Health Awareness Month this month also. So we're just trying to get our message out there, and we're looking forward to our meeting in June. Hopefully in June or July, maybe we can meet in person. So we're really looking forward to getting together. So thank you for all the updates and for still having this meeting. And I will turn it back over to Charlie. Thank you.
Thank you so much. And Chair Pena, that's the end of our reports.
Thank you. Appreciate it. Actually, we have one more presentation this evening. I know on the public agenda, there was a presentation, an item C, which is security improvements at APS discussion. We're going to table that until we meet next time. So the final presentation that we have today is the school-based violence intervention program presentation. And this was a request from former CAO Sarita Nair, requested this item be placed on the agenda, and the following people are going to be presenting on this matter. And I think the name is Jerry Bachicha, the VIP project manager in the violence intervention program at APD.
Madam Chair?
Yes.
Can I just ask one question for the record? Or I guess we don't have a record, and sorry, right before, just to Charlie, you said induction of Suboxone at MDC is happening, like it's actively happening.
Yes, ma'am. Finally.
Okay, thank you. I just wanted to
I
hear
know.
it and affirm it a few times.
We're very, very excited to have that. It's very, very important for the clients at MDC for both while they're incarcerated and when they release into community. So we're really grateful to have that up and going, and it's going to be integral to the services there.
Thank you. And thanks for all the presentations. And sorry, I'm excited to hear from Ms. Jerry Bachita. Thank you.
Thank you.
Yes, Commissioner Barbo, please don't apologize. I echo your sentiment. Yay, Charlie, yay, MDC, yay. It's such a huge step in the right direction. So thank you all for the work you're doing. I think unless somebody else is going to show my PowerPoint, I will share my screen. Okay, so can everybody see the screen?
I can see it.
Great. Okay, I'm on the wrong page, but I will get to the right one. All right. Screen mode. Okay, so my name is Jerry Bachita. I'm here from the city of Albuquerque, the Albuquerque Community Safety Division. I'm the Violence Intervention Deputy Director for that department. If you all don't know, that's one of the newer departments in the city of Albuquerque and the third arm of the 911 response. And Violence Intervention Program has just moved underneath this. It's a great alignment, and we're really happy to be part of that new and very exciting and innovative department, because we feel we're a new and very exciting program for the city as well. Although we are 2 years old. So the school-based violence intervention program has not begun. It's what I'm here tonight to talk about is the program that we've developed to pilot for the next 18 months. I'm really happy to say that the Kellogg Foundation has funded this pilot, and but after 18 months, we'll have to consider how we're going to fund going forward if the proof of concept actually is viable. So I want to tell you just a little bit about the violence intervention program so that you can understand really what why this work is a little bit different than some of the other programs that you're seeing being implemented in schools across the country. And so this chart kind of helps me explain that. We're called the Violence Intervention Program. We do focus on intervention. The investment results of intervention, if done correctly, can happen in as little as three years. So the importance of that is identifying and intervening with those at highest risk for gun violence or other violent acts. What you're seeing being implemented across the country in a lot of schools is prevention programs. Schools often have prevention already embedded in what they do on a day-to-day basis. They have trusted teachers, they have counselors, they have medical professionals, and like some of our schools in Albuquerque, they have school-based health centers, and they have sometimes community organizations that have offices within their schools. So there is a lot of prevention work going on in the schools. And then transformation. And transformation is that 15 to 20 year result. And I think that's where we're going with our trauma recovery center, which is something that the violence intervention program is implementing within the next year, that deals with the generational and historic trauma that people have experienced as a result of violent crime in Albuquerque. So, but that's transformational. And as you can see, What we're focusing on right now, because the Department of Health has seen gun violence a pandemic or epidemic within the state of New Mexico, that we need to focus in on the intervention. As far as the schools go, that translates into what's called secondary prevention. And secondary prevention it is different from primary prevention in that an incident occurs and then we intervene to prevent future violent incidents from happening. So that's kind of the difference in what we do as a program. This is our program model. And we really we approach the reduction of gun violence through a public health framework. We always lead with public health. We directly communicate with people that have been identified as high risk for being involved in the cycles of violence in Albuquerque. We developed a different social services support model that really employs day-to-day kind of mentoring, coaching, and social services so that folks don't fall through the cracks as they navigate our systems. We utilize focused deterrence on the law enforcement side, which is just a fancy word for saying we're looking for the individuals at highest risk, and we're not out there to do any more harm to communities that have already been inundated with law enforcement and different police operations. We use mediation and we do trauma recovery. And we also use data analysis to drive what we do as we move forward with our daily work. So national best practices tell us that 3 things really can drive gun violence reduction in schools. And number 1, that there's a safe school environment, that there's trusted adults, and that the response of those trusted adults is trauma informed. So that could be community-based organizations, like I said, school-based health centers, counselors, psychologists, nurses, and that there's multiple ways to communicate any threats to students, about students to teachers, and there's adults in those schools willing to take immediate action. Early identification is also a national best practice, and it takes multidisciplinary teams to do early identification because it takes communication. And I heard May talk a little bit about communication between the different police officers in the schools. There's, of course, BCSO, there's APS, and there's APD. So those responses, can be delayed if people aren't communicating. So these multidisciplinary teams are really important, and over communication is really important too. And part of our work with West Mesa was to identify how we could be part of those multidisciplinary teams so we could be part of that communication. And the other piece is race equity in practice. Equitable practices make for best practice nationally. Using tools to help students resolve problems is part of that equitable practice. Teaching students how to do restorative justice, mediation, and de-escalation is really important. Not to over-rely on punishment, to manage the implicit bias in disciplinary action so that students don't feel like they've been wronged, and to become a trusted school in the community's eyes, a safe place for families and students to go, because it's so much a part of the community and its diversity, which we do have a lot of in New Mexico. So what we've done with the West Mesa since last fall is to be really intentional about mapping the school resources that already exist. There's already multiple multiple best practices happening in West Mesa High School that we have identified and we want to align with. We're not stepping into overlap or, we're looking for gaps so that we can fill them and enhance the best practice that already exists. So we started mapping out referral criteria and the processes for us to get referrals. And it's got to be multiple, but there's got to be one point of contact for our program so that communication is clear and processes are clear. And we're creating pilot goals and measures with PIRE, which is a research center here in Albuquerque, the Pacific Institute for Research and Evaluation. And we're creating feedback loops so that we can, along the way, be able to understand what's working and what's not. We're also creating communication loops so that that early identification doesn't get missed. These are all the things folks are talking about nationally too. How do we do better in all of these areas? So the program that we have developed as a result of all of that work since last fall has two components. And the first one is the peer case manager intervention. And this intervention is with students that are at the highest risk of being involved in violence in the schools. And we're still developing the criteria with the schools, but we're getting closer to some ideas about that. And one of the target populations will be those students returning from long-term suspension or expulsion for having any sort of weapon or violence in their history of incidents at the schools. The other thing that we're doing is we are hitting some primary prevention with healing spaces, building healing spaces within the school that allow community to come in and work with the students and their families as artist mentors. And I think it really is important to note that both the case managers and the artist mentors are also including families in their work so that we don't disconnect students from their families as they're often done. One of the gaps that we realized as we were moving forward is that some school counselors can go out, take food boxes to families and things like that, but they really can't spend their time with the intense interventions that those families may need to really help those families navigate through systems and stabilize maybe their housing needs or their substance use challenges that they're having, or they may be having employment issues. And all of those things are things that the counselors really want to do and expressed interest in doing, but said they just ultimately cannot do that because there's so much to do on campus and they're really, their jobs kind of end at the end of that property to some degree. So, we really saw amazing things happening in the school and we wanted to enhance what they've started. So we were really excited about using these dual components to move into West Mesa and see how they affect the amount of violent acts committed in the school. So like I said, the population of students served are youth at risk of being suspended or expelled for threatening acts, youth who are suspended and expelled for threatening acts against each other. Those are the students that end up on our radar later on down the line because they've been disconnected from the protective factors in school and they end up in groups and gangs in our city. So we want to make sure that if they are suspended or expelled, that we're there for them throughout that year or semester until they can get back into school. And youth at median risk for school threatening acts against others Those youth would go to the Prevention Artist Mentor Program. And that's a whole semester program and involves the families of youth. And our goals and evaluations, our big goals are to bridge the gaps in the city and school systems that have left young people susceptible to criminalization and the cycles of violence. We would like to see the reduction in long-term suspension and expulsion rates for youth at high and medium risk for violence. We want to increase the successful outcomes for youth who are at this risk for being involved in the cycles of violence and are re-entering from long-term suspension and expulsion. And we'd like to increase long-term services to families who have complex trauma and multi-layer challenges. So this is the program in a nutshell. It is different than other programs you're going to see implemented in schools in New Mexico and across the nation. It still has that whole basis of see something, say something. The schools are already doing a good job with that message, but again, we're here to enhance that. We're here to bring the community into the school. We're here to measure if the community feels better about the school as they start to participate more in the after-school program. And we're definitely here to intervene with those at the very highest risk for potential violence within the schools. And I want to thank Principal Michelle Torres for kind of rolling out the red carpet for us, and you know, her higher ups that are just as enthusiastic about this work.
Thank you. Are there any questions?
This is Yolanda Montoya Cordova with Albuquerque Public Schools with the board. And I just, first of all, I just want to say thank you for working with us in the collaboration, because I know immediately following the tragic event at West Mesa, there was definitely an outpouring, and could see that there was an interest in like, what can we do to come together to collaborate to really support a community that was definitely, you know, experiencing some significant issues and concerns. And I really appreciate the approach that you're taking from looking at, you know, the fact that the school, you know, does have some good things in place, but still needs some help, that there's always room. And I think that's kind of what's happening with a lot of our schools, is that it's like that, you know, there's a certain level that we can get to, but in order to get to that next hill or to get to that next level of support for the families that are at highest risk, it really does require coordination and collaboration with the city and the county, because those are going to go beyond, you know, what APS is funded to do and has capacity to do. But, you know, how do we leverage the expertise and I think the willingness to do this? And this is an excellent demonstration on that. I guess my only question I have is approximately how many students do you anticipate that would be part of this particular pilot?
So right now we have a list of 20 that we could potentially work with right in the fall at the beginning. And that would be long-term suspended and expelled students coming back to school from last year and last semester. So we are going to try and narrow those down to, like I said, the very, very highest risk, so that we have room to, you know, do that work with integrity and make sure that our pilot has impact.
Really, and to demonstrate, yeah, I agree with you, and to just get into that deeper level of the pieces there. So thank you. It's a wonderful start. Thank you so much. I probably have other questions, but I can see Board Member Gonzalez has also raised her hand. She probably has some great questions as well.
Thank you. Board Member Gonzalez.
Thank you. I had two questions and just wanted to start with tremendous appreciation for this work, which is so needed across the community. And somewhat related to the first question I have, which is obviously resources are always an issue, but our city did experience two shootings near schools, three this year. So near Albuquerque High, the shooting on the Washington Middle School campus, and then the shooting near the West Mesa High School campus as well. And so just wanted to understand a little bit more about what, if any, resources could extend to those communities as well. Because I do represent Albuquerque High and Washington, and hear quite frequently from those families that they do feel very left behind in some of the response efforts. So just curious about, I understand it's a pilot, I understand resources are limited, but are there other opportunities to extend?
So on a case-by-case basis, like we responded to, if you remember, the shooting at across the street from Sandia High School. We did work with one of the students involved in that shooting, the student that actually got shot. So on a case-by-case basis, we will go out, but that is very, very far after the fact. We've been contacted by several schools, Atrisco being the largest one, for the possibility of kind of, extending our services into that school. The caseloads for this type of work, because we're not using a regular social services model, that model has kind of failed these families and these youth. Because it's so intensive, it's almost daily contact, coaching and mentoring and system navigation. 15 to 25 on the caseload is kind of the max for that at this point. But we will do our best in really tough situations for other schools if we need to try and help out. We just won't have much capacity. We really appreciate the Kellogg Foundation for funding this, but as of right now, this is costing close to a little over $300,000, plus the support from the administrative support from, like me and my special projects manager, Dr. Elizabeth Silva. So, it is an expensive endeavor, but this kind of investment in our schools, I think we can lower the cost if, we think about how to do that. And that's actually part of the 18-month evaluation is how do we lower the costs and sustain this type of work? And, but keep the integrity and the quality of what we're doing. So that will definitely be a recommendation as part of the evaluation as we move forward. And I know the urgency. I live with the urgency every day when it comes to gun violence. And I wish that we could service all the schools. And, but I think if we can get through this 18-month pilot, and, I cried the day that West Mesa had the shooting because we were working so hard to put this in place so that wouldn't happen. And it was really, I understand the urgency, and I apologize for not being able to give you a better answer for that. But I am confident that at 18 months, if we're really, really intentional about this pilot, and we really do well, that we'll have some answers for you that are hopefully very good.
I appreciate that. Thank you. Chair, I did have one other question, but I'm happy to defer to someone else if you want to go there and come back.
Go ahead and proceed with your question, and then after you would be Commissioner Barboa.
Great, thank you. So my other question is, although the violence in this instance is happening on or near school grounds, we know that it's obviously connected to a host of other community issues, including not just access to guns, but the presence of ghost guns. So I'm curious about what are the related policy changes, or has there been an analysis of policy changes that need to happen at the city level, county level, and potentially APS level to address sort of the bigger picture?
Yes, thank you for that important question. Right now, I also facilitate the gun violence task force at the city level. And we have 4 committees that are ready to start taking a look at those policy level questions for the city and making recommendations to Mayor Keller at the end of our gun violence task force year. So yes, we are looking at that. The city also had the Mayor's Crime Initiative and put forth a lot of different policies as well. We are seeing some indications of ghost guns, but I don't think that's our biggest concern. They get a lot of attention, but we don't see them as much as we just see regular guns that have been either stolen or just taken are very accessible to youth. There's a lot of selling of guns happening to youth, and youth are dying because of robberies around those types of transactions, as well as vape transactions, drug transactions, so and group violence, but it's more individual and disrespect with youth rather than groups and gangs.
Thank you for that. And I would appreciate if there is any conclusion as part of that process that you think leads to necessary policy changes in APS as well. I think we'd be open to that. Thank you.
Thank you very much.
Commissioner Barboa.
Thank you. Thank you so much, everyone. And appreciate this conversation and the questions. Yes, Jerry Batista knows me well. So I wanted to, and I'm very thankful for this program, the approach, and that y'all have already started implementing it. I always, and of course I talk a lot, sorry, but I always, and I just say this in all respect to the program as well, and how we keep doing it, that these things aren't new as much as they're new, and they are, I think, different from the way people are talking as a response to gun violence, I guess, right? Because I think about, as I was a young person that was, I guess, framed as a at-risk youth program, I remember being pulled into this leadership development. And when I was in it, I sort of realized, oh, it's sort of like all us trouble kids, right? But they called it leadership development, like this special leadership team or something. And but we got to build relationships, we got skills building, we really got leadership opportunities. And then also when I was in high school, there was gang intervention programs and, theater programs that targeted at-risk young people. And then when I was at UNM, we created the Orale program, which is specifically meant to, and it was more of a mentorship program, but like a peer mentorship, again, targeted at, youth on the fringes, or however you want to frame that population of folks that are vulnerable and at risk of all the things. So I guess I only say that because I want to lift this program and make sure that we're because I only lift it because when we say something's only totally new or innovated, then it makes us think that there's not work behind it. And I think, and it also hurts the continuing sustainability of those, because I think about those programs and they come in moments of time and there's lots of resources for them, and then they go away, or they lose their solid value. There's they lose some of their best practices because they've become so just sort of integrated, and then they become part of the norm and don't keep their robust nature. So because I want to see more of these approaches, and I love that it's piloted, that it's paid for, and then we can see some results and hopefully gather our resources and put into it being more. And you said that at the beginning, Jerry, that there was that there is a sense of that you said that it could be run by nonprofits, but right now your team is running it, but the model is meant that anyone could pick it up to do the same kind of model with resources, of course, and training.
Right. Commissioner Barboa, as usual, you're right on the money. And what you just said is deeply, deeply insightful from lived experience. And so I very, very much appreciate that she said, this is nothing new. I mean, folks have been doing this for years, and the only reason that it didn't continue is because it wasn't sustained. And to be totally transparent, there's a reason that Sarita asked for me to be on this call. And it's because we want to tell you about this prior to doing it, because we're all going to need to sustain it. And part of this pilot is to learn how we can sustain it. But it takes a village, as they say, and I sometimes hate those terms, but when are we going to stop duct taping everything together in New Mexico? We have hurt our communities tremendously. We have beautiful ideas. They've all worked. They've worked for individual kids, but we have to expand these things. They have to become scalable. And so this is really an important part of our project and a condition of our application to Kellogg, that we find a way to sustain this and scale this, and I will come back to give you a report, and I will ask you all to think about how you're going to contribute to the expansion. And I know that the city is willing to continue to, put some staff towards this, but we certainly can't solve the entire problem alone.
Thank you. Madam Chair.
Thank you, Commissioner Barboa. I don't see any other hands raised. I actually just wanted to ask a couple of questions myself. One, obviously there was a shooting near West Mesa High School, but my question is, why was West Mesa selected?
West Mesa was selected because they were open to us talking with them. And so our program's under APD, and Commander Torres works for APD, and his wife is a principal there. And so I also knew I think he's the regional director there as well, worked with him at Atrisco Heritage when he was principal. And he had opened the school at Atrisco Heritage to community organizations, allowed them to have offices right there in the school. And they went from having a long list of kids who failed to even graduate to a long list of kids who wanted to attend the school, a waiting list of kids that wanted to attend the school. And so that quick turnaround was because he allowed a lot of community-based agencies in there to help with enhancing what they were doing in the school already. And so I knew that they would be somewhat open, so I approached them for that. So it was kind of a little bit of a biased selection, but we needed an open door. It was urgent, and that's how we picked that school.
Thank you, because it just seems to me as though, maybe there would have been data to show where there are schools where people were taking, guns, and they had confiscated guns, rather than, just kind of I understand. I think the program is going to be awesome. I just always kind of raise my red flag when, programs like this are implemented in marginalized communities where there's already a propensity to kind of think that people from schools like this are kind of the ones that are going to create the havoc, if you will. I think it's something that needs to be done. I would just, I would kind of look to kind of some of that data before you go to the next school, just to make sure. And then you had a slide, and if you can go back to your slide, it was right before your mission statement. Before this. It was right before you had a mission statement go up. Okay, this next one. So I think that, you know, just even this picture, this depiction of a person of color who, you know, looks like a gang member who is obviously a Chicano. And, you know, I think those pictures really kind of perpetuate kind of the problems that I see in our community when we're looking to address gun violence and who are the culprits of this, that pictures like that. So I would just really hope that you can change that picture, just because, and the way I look at it too is that, you know, I think Commissioner Barbaro was alluding to this, is that, you know, we had lots of programs in our schools before, and I think that sometimes, especially communities of color, marginalized communities that you know, have a higher percentage of people of color there, you know, it's really some of the issues that we're having, and whether you know, I would like to see the data on gun violence at these schools. But you know, it's just really lack of opportunity, that we don't have the same things that we had when we were younger, and those opportunities after school resources and the like to be able to, you know, the kids to be able to go to. It's even kind of like, even at the city of Albuquerque, you know, community centers were a safe haven for lots of people before, and now, unfortunately, you know, because of, you know, needed reasons, you know, because we have to have enough staff to be able to support the amount of students there. But then we kind of, you know, have a waiting list for community centers for all these opportunities for kids. So I just want to make sure that when we're doing these programs, which sounds like a great program, I look forward to the information, the data, but I just want to make sure that it's not, doesn't look like it's schools with people of color at them, because as you know, and just even the schools that were listed, it was near West Mesa, near Sandia, at Washington, and I think there was another one at Albuquerque, near Albuquerque High. So just, those are just some suggestions. I appreciate the presentation. I think that we're probably going to have this presentation again. Obviously, this isn't formal. This isn't going on the record. Thank you all for being here this evening. I was asked, there was just I think a domino effect of things happening this afternoon. So I agreed. I got down off of my cherry tree to make sure that I could be here. So I apologize for me not being prepared either. But I just want to thank you all for being here, and I look forward to the next meeting. And I can't adjourn or anything, but we'll see you soon. Everyone take care.